Benefits of caffeine. Caffeine acutely improves strength and endurance in most people. Caffeine reduces activity of adenosine in the central nervous system and consequently reduces pain perception and fatigue that are normally attributed to adenosine during exercise. By stimulating increased levels of circulating epinephrine, caffeine helps increase fat mobilization that may enhance glycogen preservation during aerobic endurance events, thus increasing endurance performance and time to fatigue. Sodium and potassium ion pumps are more active with caffeine ingestion, increasing muscle excitability, enhanced ATPase activity. Increased calcium ion release from the sarcoplasmic reticulum stimulated by caffeine improves muscle cross-bridge production and subsequent power output. Disadvantages of caffeine. Athletes can become tolerant to caffeine. When taken too frequently, the same dosage will no longer be as effective as it was in the past, warranting the need for higher doses. Higher doses come with more side effects and health risks. Higher doses do not increase the ergogenic effect of caffeine. Individuals with polymorphisms of cytochrome P450, the CYP enzyme that accounts for about 95% of caffeine metabolism, can cause individuals to experience little or no benefit from caffeine use, whereas others may get benefits at lower doses. Severe side effects like migraines, tachycardia, insomnia, and anxiety can be induced by overconsumption or prolonged consumption of caffeine. Athletes who benefit most. Some research has shown that men tend to respond slightly better to caffeine for muscular power and strength, whereas women respond slightly better for muscular endurance. However, accounting for individual variation, both sexes see some benefit from caffeine supplementation. Athletes that respond well to caffeine at low doses will benefit most from the supplement because higher doses tend to offer little or no extra benefit with increasing side effects. Side effects will outweigh the benefit in athletes who do not readily respond to caffeine. Both endurance and power athletes will benefit from caffeine supplementation as mechanisms for both aerobic and anaerobic ergogenesis have been proven in multiple studies. NCAA guidelines on caffeine use. The NCAA 2024-2025 guidelines have caffeine listed under stimulants and banned substances. Caffeine sources are not differentiated when tested, and 500 milligrams ingestion is the limit before testing positive for banned substance use. Recommendations. Caffeine comes with unwanted side effects when used irresponsibly and should be used in moderation with mindful reductions by athletes who experience side effects. 3 to 6 milligrams per kilo of body weight is an appropriate range for most people, starting at the lower end of the range. Doses higher than 9 milligrams per kilo are potentially dangerous and have no increased benefit. Athletes should cycle off of caffeine every few weeks to avoid developing dependency and to improve sensitivity to caffeine.